Hey, what's up, everyone? Welcome back to another beautiful week. I'm Henry, and today I have a special interview with Dr. Lisa Chan, a family doctor with International Community Health Services, ICHS for short. Welcome, Lisa.
Hi, good morning.
Good morning. Yes, it's a Monday. It's the third week of doing these interviews, and it's great to get a lot of perspectives from people who work, live, or just are a part of the community of the CID. So the first question I have in regards to COVID-19 is, as a healthcare provider in the neighborhood, what changes in behaviors have you seen in your community patients?
So, I've personally seen an uptick in patients who come in with anxiety and depression symptoms. And it's not really all that surprising given the uncertainty around COVID. People have also expressed fear about going out, not only getting COVID, but also fear about experiencing racism or bias if they're Asian or if they're wearing a mask. And I've had some patients who are actually too afraid to even come into clinic to get their medicines or get labs or even a medical visit, even though they need one.
Wow.
I've seen a lot of more fear and anxiety.
Definitely, with all the racial, hate crimes in the neighborhood, and just the factor of not being able to go outside and socialize, plays a big part of it. And I could totally see what you're saying here. Um, that's great to know. And I think it'd also be good to sort of learn your perspective of working in the neighborhood and what it takes to really serve non-English speaking individuals and low-income families. Like, what is it like in your shoe?
So I think that it takes a lot of teamwork to take care of the community because obviously I can't do everything myself. You need the help of translators, you need the help of community organizers like yourself. You need people to kind of like a whole team to really help the community. And I'm just like one small part of it. I provide like the medical perspective, the health perspective, and also advocacy part. But I think being able to work in a team is like the most important part of being able to take care of the community, especially low income, non-English speaking communities.
Yeah, I definitely agree. I think teamwork is if not the biggest component of having a sustainable and strong neighborhood like the CID is. And I think one aspect that makes the neighborhood really resilient is that this is something that we're doing, there are so many organizations in the neighborhood with good intentions, taking really good actions and supporting the community and understanding their needs. Like you said, it's very important to have translators, community organizers. So it's sort of like, it's a whole collaboration process where it's not a one person's job. Instead, it's more like a unison. We're all in together. Each person plays a piece in the puzzle. And that was well said. I really agree. And it's great to know that in this community, people are so willing to work together, and it's for me, it makes my job enjoyable, to say the least. And it's great to just meet new faces overall and learn that even though the community is not really big in terms of surface area, that there's a lot of people in it, and just knowing that it puts a smile on my face. So moving on to the next question, Lisa. So at Interim, I've been doing a lot of grocery deliveries, and you messaged me on Facebook, and you're asking if you can get some groceries. So I'm just curious, what motivated you to take that initiative to serve a few individuals, about 5 to 10 people, with grocery bags on your off days of not working? So yeah, talk a little bit about that.
So I think a part of being a medical doctor is really realizing that your health isn't really just medications. It is not just what happens inside the clinic. Someone's health is actually mostly impacted by stuff that happens outside their clinic, their social life and having access to food. And so realizing how COVID has impacted people's access to food and access to fresh and healthy produce kind of motivated me to do that. And I recognize that grocery shopping sometimes was already a hard task for seniors who might have physical impairments. And now they have this added risk of being exposed to COVID when they go out to the grocery store and if they take public transportation to get to the grocery store. So I just wanted to do my part in helping minimize the risk to these vulnerable patients and just asking my elderly patients if they have social support helping them getting groceries. And if they don't, I ask them if they're interested in getting groceries, and I just make a small list and just been delivering to them to try to do my part in the community.
That's great. And what was the reaction those individuals gave you after they received the grocery bags? Were they surprised?
Yeah, they're surprised. They thought it would cost money, and they're just, I think they're so elated to see like fresh produce that was free and was like culturally like appropriate for them, you know. So I think they're really grateful and just happy to know that someone in the community was looking out for them. So
Definitely. And one thing I really kind of learned after working for almost 3 years now, it's sort of like I used to sort of treat my job as an 8 hour, I guess, thing that's part of my daily life. But then after sort of working in community-based work, I realized that, the job doesn't just end after an 8 hour day. It's really a part of your 24 hour, day. And it's sort of like, the community still needs help. Even after an 8 hour shift is over, it's sort of like, I start to ask myself, what happens in the hours after I get off work? What are their needs during that time period when I'm not there? What is something I can do? And sort of just learning more about, you just volunteering, I guess, on your days off really kind of made me think about that again. It's sort of like being a part of a community and being a community supporter. It's sort of like extending your arms outside of your work hours and just kind of embracing your community as a whole. Even though, it's not your job, it's something that you really want to do and makes you feel fulfilled. And yeah, it's great to work with you in this part of serving the community through groceries. And I hope we do continue it. Um, Moving on to the next question. Health is a huge component of having a sustainable life and community. What do you think are the next steps for the community members of the CID to take to be more resilient?
yeah, so I actually think the ID community and the residents in the community have already shown historically that they're a resilient community. They've withstood a lot of pressures from gentrification and racism. And so I know that at the heart, we are a resilient community. And I think this is just another difficult time period that we get through by coming together as a community and doing each of our own part to take care of each other. I think there's like a few different ways that we can do this. And one way is to first like be kind and compassionate with yourself. I think it's a scary time and it's natural to feel scared or overwhelmed during this time. So it's okay to take time for yourself to take care of yourself, and it's okay to ask for help. And then the other thing I think is take the initiative to reach out to a vulnerable person that you know or an elder and check in with them. Make sure they're doing okay, see if you can help them with obtaining their groceries or getting their medications. And then I think the final thing I will say is that recognizing that the disparities between health and social disparities that are really apparent now, the systems that cause it, the underlying systems were always there. It's just more pronounced now because of the COVID pandemic. So I think it's important now more than ever to be politically engaged and to advocate for your community and to advocate for vulnerable populations.
That's great. And I agree with you. It goes back to, being there for the community, even though it's outside of your job description. And I think when there's, meetings that sort of engage the communities, it's important to be present. If there's any need for translations, being that person to, utilize your language capacity to really help these people is important as well. And I think for me, being, I'm 25 years old, and I think growing up, like, jobs like being a doctor is a very prestigious status. And I think growing up, it's sort of like, dang, I'm kind of nervous and scared to have a conversation with someone who's a doctor. And I think after meeting you, Lisa, and sort of just having normal conversations, it's sort of like, no matter what position you're in, people are still people. And it's normal to have, one-on-one conversations to just kind of learn about each other. And I think for me, it's just sort of like breaking that barrier. You realize that, no matter what people do for a profession, people are still people. They share the same emotions, the same hobbies, the same expressions. And it's great to know that. And I think for the younger listeners, or maybe even the older ones, it's have a dialogue with your peers, talk to the people next to you. And I think from that, you'll find more love in being a part of the community. Wouldn't you agree?
Yeah, totally. Yeah, I think, I think media and maybe like old medical hierarchy kind of perpetuates that doctors are this white coat, prestigious, far away thing that you can't really connect with. But I think that it's important to see doctors as someone that is another peer or another colleague that's kind of helping you through your journey of life and your health. And I want to be people's partner along their life. So yeah, so I think it's important to put a human face and to see the humanity in all people.
Yes, and we have a great example right here, Lisa. um, so just kind of closing off this interview, do you have any last advice for our listeners today? Any last things you want like to share?
Um, so I think my advice would be, don't be afraid to speak up and advocate for your community. Speak up against racism when you see it, stand up for yourself, and be politically engaged. I think that's the most important thing right now, to really try to fight the system that is causing these disparities that we see and take care of each other. Come together.
Come together. All right, that's awesome. Well, thank you so much for your time, Lisa, being on this interview with me. I really enjoyed listening to what you had to share, and I definitely took away a couple things myself. So yeah, have a nice Monday. Have a great week. I'll see you later, Lisa. Till next
All right.
time.
Take care.
Peace.
Bye.
All right, I'm gonna end the recording now.
Okay.